Thank you all for joining. We're going to explore today with my panelists the question of, is it time to pump the brakes or hit the gas as it relates to AI? I have spent my entire career with one singular goal to improve patient outcomes. And so I would like to take that into our discussion today with Ngan and Ellie. I'm going to turn to Ngan and Ellie to have them give you a brief introduction of themselves before we start our conversation.
Thank you, Nolan. So my name is Ngan MacDonald, and I am director of the Health Data Innovation Lab for Mathematica. I also have a dual appointment, and I am chief of data operations for Northwestern's Institute for AI in Medicine. My entire career is really around data and how do we strategize, manage it, how do we use it to drive better outcomes. So thanks for having me.
Thank you, Ngan. Ellie?
Yes, thank you so much for inviting me and for this conversation. I'm really looking forward to it. I'm Ellie Graeden. I am the technology partner and chief data scientist at Luminos Law. We're a small boutique AI-focused law firm. And I wear a second hat as adjunct professor at the Georgetown University Massive Data Institute with a secondary hat at the Center for Global Health Science and Security. A little like Ngan, I am a technologist at heart, really focused on how data get used. That's meant that I've spent the last 15 years really looking at data and models writ large, which has, very rapidly turned into AI now. And it's really, I'm always thinking about how we apply it and use it to actually have impact in the world.
Excellent, excellent. I would like to start frame up our conversation a bit, right? As if we think about all the things that are happening across the healthcare ecosystem, from provider, payer, consumer retail healthcare, farmer, med tech. What is it? How might we leverage AI to improve patient outcomes, right, across the entire healthcare ecosystem? Ngan, what are you thinking? What are some of the things that you think we might want to tackle in order to truly move the needle?
Yeah, so I always kind of go back to the underlying data. And so we know that healthcare uh, is inherently problematic today because we have people who don't have access to healthcare. We have systems that are not connected together, and we have just a whole host of complex incentives which cause people to not always share data in the way that they should. And so I think one area that we need to tackle is around interoperability and really creating that system in which the data uh, is available when it's needed. And I think it's a misnomer to think that, we haven't used AI in healthcare because we have. We do use AI every day for things like risk scoring to determine
That's right.
who's the most likely to get sick next. And then, like we have areas in which we use it. Right now at Northwestern, we're piloting the ability to use ambient listening to allow the AI to summarize a visit and then present that back to the physician for him to add his thoughts or approvals on it. And it decreases the amount of time they have to spend actually trying to consolidate those notes. And then, like you think about other things that are more low hanging fruit. So, like public health, for instance, we could use AI to do translations of materials, educational materials, much more easily. So sometimes it's not just that we do the fancy AI, but some really basic blocking and tackling is necessary in order to advance healthcare across the ecosystem.
And Ngan, I really appreciate that and underscore the whole interoperability piece. It's just critical and foundational to a lot of the issues that we have across healthcare. Ellie, what do you think? What are some of the things that we might tackle to advance care?
Well, I want to underscore what Nan just said about the fact that we've actually been using elements of, advanced analytics, machine learning, and AI for a lot of years, both in healthcare and in facilities management. When we sort of think end to end on these systems and we think about how healthcare, the full sort of suite of how healthcare systems work. So I think, everything from using diagnostics, we have really good machine learning on image recognition. Now, I think one of the really important pieces here is that where we see the most effective use cases are where we're dovetailing it to augment human capacity and human expertise.
Yeah.
And so what we're really seeing in the healthcare space, and have for a long time, is that it's an adjunct. It's a really useful tool for our experts to be taking advantage of, to make their life a little easier, to do some automated checks, to be guiding the process, and to be doing the things that machines are best at. Right? But machines are very, very good at bulk ingest and actually integration. A lot of the work one of the places that LLMs are actually becoming really useful is in taxonomy and ontology development and structuring. That sounds very wonky. It's sort of a big, data merge problem, but it turns out that it's actually a really effective use case, because what you're figuring out is how to get data that come from very different places described in very different language to then merge and be able to drive some of the address some of the interoperability challenges that you were describing, Noland. So I think a lot of this is in identifying what the right use cases are, where specific types of models are going to be most effective, and applying them in those specific contexts. It's not, what we're talking about here isn't just a one-stop roll out AI and replace the humans.
Right.
Yeah. One of the things I really enjoy about what you both kind of discussed here is that, everyone they tend to think about these really elaborate use cases. And what you both kind of laid out is just some basic blocking and tackling that we could do to really advance care across the healthcare ecosystem. And I think that would be a big takeaway, right? There's some really far out whiz-bang things we could be doing, but if we just look at some of the basic blocking and tackling, right, some of those use cases, they would be pretty impactful. As I think about that, I start thinking about some of the things we should consider, right? As we think about what we can improve and how to do it across the healthcare ecosystem, I think it leads me to three things, right? What are some of the key things we have to consider as we select those use cases? So one would be around patient safety. I think it's critical that we start there. The second would be around data governance. How do we ensure that the data that we're using to build our models are in fact good data? And then finally, it is data-enabled workflow. So how do we make sure that the data is landing at the right place at the right time, so that a practitioner or an administrator can make the right decision regarding their patient or their member? So let's start at the top. I would love to get your point of view about patient safety. Ellie, you want to jump in and start it off?
Sure. I think there are a lot of ways to define patient safety, first off, right? There are the sort of practical and tactical issues around just even moving through a hospital and making sure that the right information is with the right care providers at the right time, right? There are some really basic workflow information transformation systems where what we really need is information to follow the patient through their whole care journey. And so I think there are some basic things that we can do there that are mostly about making sure the right data are available to the right person at the right time. So that's a security component. There's a privacy component. There's making sure that we have, and it sounds very, again, a little wonky here, but it's about good data governance and provenance. It's making sure you know where the data came from, who has the authority to see those data at different levels of resolution, and making sure that it's transferring through the system well. So I think there's that piece of it. There's then also the piece where a lot of those data can drive some automated decision-making and checkpoints that can actually highlight and improve, for example, which types of care are being offered by different providers. And that's where we can actually start to get to, identifying characteristics of the patient that we might be able to highlight specific types of care that would be most effective for them, and really streamlining what is becoming a very information dense environment for the healthcare providers. This is a way to start to prioritize some of that information and improve decision making. There's a great example. Mike Rio's group at Ohio State University has been doing some really interesting work looking at decision support systems that integrate large amounts of data and surface it to dramatically reduce the amount of time it takes for a hospitalist to respond to a code blue. So code blues are when you're talking about, you have sort of 90 seconds to 3 minutes to save somebody's life. And if you can get them the right information really quickly, you can actually reduce that response time by 30 seconds or more, which is a huge differentiator for the ability to save lives. So I think there are a lot of these types of very specific applications that do a lot to meet patient safety, both in that sort of privacy and governance domain where we're actually taking care of their data, but also very practically just improving the quality of care they receive.
Yep, that's awesome. Ngan, could you weigh in here?
Yeah, absolutely. So one of the things Ellie mentioned is talking about provenance of the data. And, I'm going to kind of swivel it towards patient safety in regards to do the models actually apply to the populations that they're intended to apply to?
Right.
So because of some of the inherent irregularities in our data, what you see happening is, we have an example, for instance, there's a sepsis model that when it rolled out, it was supposed to be like 80% accurate in predicting who is going to get sepsis. And the reality is, once it was rolled out at the local level, University of Michigan had this study that basically said, I think it was 47% accuracy in terms of predicting who was going to get sepsis without prior clinical assessment by the team already. So that, that's actually like less than a coin toss. So we want to just be sure as we look at the patient safety aspect, we look at the data that is being used to train these models to determine whether that data population actually even applies to the population that you're triaging. And so I think that there's also this element of governance and being able to kind of make sure that the results that you're getting out of the models that you are trying to deploy make sense within your population, or whether it's something where you may need to retrain it for your local population. I keep telling people all the time, it's like, while there are 8 billion people in the world, and there's probably someone with a similar health condition to you, the reality though is healthcare is extremely local because the resources are different, the populations are different, and what you have access to is very different. And so we have to think about patient safety, not just in terms of like, is somebody going to fall, but also in terms of, are they getting the appropriate triaging, and are they being appropriately identified by the models?
Yeah. And you speak of data governance, and this is something, oh my God, I think all the clients that we work with, they all have some varying levels of data governance issues, right? From not having any to not having the right kind of data governance. Ngan, could you continue to talk about that a bit? Tell me what you think about data governance as it relates to this. Right?
Well, the thing about AI is the data is the foundation for all AI
That's
models.
right.
And so that means that if you don't manage your data and you're not proud of the data quality that you have, that means that you're not going to be proud of the AI model that comes out. And so, we have to learn how to do things like be able to quantify where the gaps are in the data and actually measure what bias we're seeing. The problem is every single data set has bias. But what we don't know is, does that bias affect this particular use case or not? It may be okay, to have bias in that data if it's something that doesn't actually affect that particular condition or that particular model. And you won't know that unless you've actually put in place processes that actually measure and evaluate what is coming out of your model, and also what is the data that is going into your model, and what is it that you expect. Measure all of that, because the only way we can determine whether or not something is effective is if we measure it.
That's right. Ellie, what do you think?
Yeah, building on exactly what Nan was talking about, I think this is to really underscore, you have to know where your data come from, and you have to know what those data are, what restrictions are placed on the specific types of data, for their different use cases. So if we're trying to get to patient models, we need to be checking for HIPAA compliance all the way through. We need to be checking for bias, or doing bias checks all the way through. One of the things that our firm does a fair bit of actually is actually performing those types of bias checks, not just on the models themselves, but evaluating the entire sort of life cycle from data through models to products, because it's not enough to just go in and do bias testing in one specific place. And we sort of talk about a lot of the governance issues right now about being AI specific, and a lot of, we have people come to us and say, oh, but none of these laws are in place yet. And so like, well, no, actually, we've been dealing with basic EEOC requirements since like 1964. This is, we are simply being held, these models and the data that feed them are being held to the same basic requirements that we've had all along in terms of fair business practices, in terms of unbiased use cases. And so it's up to us to make sure that we really understand where the data are coming from, work those and follow those data through the models into their different use cases and evaluate them at each stage. That's where we can get to much better implementation of data governance and actually make it an end-to-end system that's really effective, both for the business use cases and therefore, in this context, patient use case and patient utility, but then also making sure that really we're doing our sort of due diligence, if you will, all the way back to the source.
Exactly. And thank you for that. I want to step into the whole data-enabled workflow. And this is one that's kind of near and dear to my heart, I think, being a re-engineering change management person too. So what do you think, Ellie, about data-enabled workflow? What comes to mind for you there?
I mean, I come back a lot to, again, what is the specific use case and where can we use very specific types of models for different types of applications? So if you're a hospitalist, it's going to be decision support tools on your phone. Those are the kinds of things that they want to be able to pull them up and actually be able to work through the information they need. This is the sort of code blue type app is the emergency level view, but there's basic patient management information that really needs to be tracked. I know this sounds funny, but it's the integration of data sets that really haven't talked to each other, like facilities data with patient level data.
Exactly.
Right? With some of the work that I did during COVID was looking at hospital impacts from hurricanes. And when you get evacuation status or power outages, those data in facilities dramatically change the type of care that can be provided. Obviously, if you're evacuating ICU patients, that's a whole level of care provisioning that's dramatically changing. But it turns out those databases, those data systems don't actually typically integrate with healthcare data systems or the patient level data. Well, that meant that it was really hard to know if there were, for example, COVID patients or ICU COVID patients being evacuated versus your sort of you're just non-infectious ICU patients being evacuated. Those require different levels of response, but we didn't have that kind of information because we weren't integrating those data. This gets down to hospital operations as well. And again, I think it's about coming up with these really creative ways to do data integration that doesn't sort of impact the privacy and health compliance on the patient level side, but that enables those data to be used for practical operational purposes as well. So I think this goes in both directions, but to me, it's about how do you get the right data, and this is where we go back to the data governance and the provenance pieces, pull the right data into the right decision frameworks for the right people. And all of a sudden you can dramatically improve everyone's ability to do their job and to serve the patients in the end.
Yeah. One of the things that you haven't mentioned is we've been talking about this from purely a provider or maybe even a payer point of view, but not necessarily from a patient point of view. What do you have any thoughts about that, Ngan, at all?
Yeah, I mean, from
As
the
it relates to, yeah, go ahead. I'm sorry. Yeah.
Yeah, I think from a patient point of view, there are very simple things that we could do to data enable some of those workflows. Just even think about like how do you make appointments with your doctor's office? Today, it's very arduous. Like you call a 1-800 number and then you wait on hold. Maybe they call you back, maybe you get through And it feels very hit or miss. And what we could be able to do is be able to data enable that workflow so that, like there's a smaller set of choices for what is it that you're looking to schedule for, and then have the information about, like what does that mean? Like the patient shouldn't be expected to know whether am I doing a preventative measure colonoscopy or am I doing a diagnostic colonoscopy? Like that information exists in the EHR. We just have to be able to integrate it in so that, it helps the patient do the things that they're able to do. And, I always think about, when you think about data enabled workflow, think about how does it augment a human to be able to do their job better. Medication adherence is another one, right? Like, do we even know that the prescriptions are getting filled? And, if they're not getting filled, then maybe it's a conversation, like you serve it up at the right time to the physician to say, you may want to ask your patient about this. There's probably a way for us to look at labs data and see, the levels that people have, and does that correlate to whether or not you're taking your prescriptions or not. I will tell you, my mom is 84 years old and her medication adherence is spotty at best. And so, like those are ways that, are very simple to be able to kind of create that data enabled workflow from the patient standpoint. Um, but another thing that I want to kind of say is this AI thing, it's a team sport. Like uh, it can enable different people, but you have to be able to bring both the clinicians to the table, the technician, the data scientist, and those are not always people who sit in a room together to like
That's right.
try to figure out like what is the use case that is going to work for both the patient, for the provider, and maybe the provider isn't the doctor, which oftentimes, like from a technology company, people who write software think, well, I'm just going to interview a couple of doctors and call that a day. And that's not what data enabled workflow is all about. It's about actually studying what exists today and who are all of the players within that workflow, and then making a decision about what pieces of that do we augment versus what pieces of it we can automate. Um, a really crazy one that a friend of mine works for GE Health, and her team uses machine learning algorithms to listen for sound. And when the equipment makes a certain pattern of sound, they know to send the technician out. So they can proactively deploy somebody to be able to like fix the machine before it actually even breaks. I mean, that's not even like about privacy. It's, like these are cool uses of healthcare data that it's not a high risk type of situation.
Yep. Yep. That's awesome. As you were talking, I was thinking about other parts of the ecosystem, maybe that might include, state and local government and federal. And any thoughts about how they might participate in this? And if you think about it from a federal point of view, from a state and local government point of view.
Um, so from the state point of view, obviously most of our public health infrastructure is regulated at the federal level and
Yeah,
then implemented at the state level. Um, at the local level, that ability to really collect data that doesn't necessarily exist within the traditional healthcare system.
yeah,
I think about a partnership that Mathematica has around the collection of wastewater and monitoring of wastewater to determine, where the opioid crisis is going. Like you can see it in the wastewater before you see it in like hospital admissions and overdoses and death. So to be able to intervene early as you start to see, it perking up, and be able to take, using AI, be able to translate to somebody's own context what it means, what opioids do to you, and what are the effects, and like maybe to the individual people who actually have sway in that community, and that's going to be different for every community. And so I think that there's a huge impact that AI can have in like the public health sphere.
Thank you for that. I tell you, patient safety, data governance, and the whole data-enabled workflow, they're just the top of a whole list of things that we need to discuss. And we could talk about this for hours. I know we already have, and we could continue doing that. But I want to give our listeners kind of, some thoughts about parting thoughts about, how you would tell them to get started, or what you would recommend them to do if they are in fact considering an AI use case. What do you think, Ellie? Where would you tell our listeners to start?
So this builds actually a little bit on some of your question about the sort of state and local and federal uses of AI, because I think the places I would start. So first off, at a baseline, if someone is thinking about implementing an AI system, the first question has to be, what problem are you trying to solve? Right? There has to be this focus on the problem, the outcome, what we're actually trying to do, because that's actually what's going to tell us which type of model is effective and what's going to be the appropriate model or analytics to be applying in this particular case. For example, when we're talking about LLMs and these transformer-based systems, these are fundamentally probabilistic outcomes and probabilistic models. They are designed to have some outliers in their results. So they can be really effective when we're trying to do something like improving basic communication person to person. The translation example is a really good one. Whether we're talking about a relatively rare language, or whether we're talking about sort of communicating or translating medicalese into human English, right? I think we can think about translation in both those contexts. That's a specifically targeted use case for LLMs. But going to LLMs to ask for healthcare style information is probably much less of a good idea. You really want question and answer pairs there, for example, that have been vetted, validated, and are a more deterministic output. If we move backwards, though, we can also start to think about the types of data that are being stored by states that, for example, maybe a early 2000s SQL database that is keyed on the individual that tells you where everyone is vaccinated. But because it's keyed on the individual, you actually have to get the name to be able to find the neighborhood level information. But if we can extract that using a model, have neighborhood level information, we can then marry that up certainly to data coming out of the wastewater system, for example, opioids or a specific disease type that we're looking for. But we can actually also do that now looking at the water sources, where there's actually some new legislation saying, hey, we need to be evaluating water sources for contaminants at the source before it's going into our water. And we could pick up things like lead contamination based on downstream impacts on neighborhoods, right? So it allows us to go full circle. Again, as we start getting really tight about what those use cases are, that's where we can say, okay, here's this use case. What data are going to be relevant? What types of models will be useful? Where do we have that full chain? And then we can start to apply them in these very, very specific domains. And I think in what we're seeing, there was this really sort of big push toward broad applications. We're going to have one AI to rule them all sort of systems. I think more and more what we're seeing is people applying AI in the context of the way that we've been doing modeling for a long time, which is specific models that are tailored to very defined use cases. And that's actually where we get the most value.
Yeah. A follow-up question, Ellie, one of the things I think about quite a bit is that, I love the point that Ngan made about this is a team sport. And I think a lot about the strategic partnerships that should be considered when building some of these use cases. And I think about a lot of the misses where our clients may not even be thinking about, hey, if we team with this organization to leverage these data sets, we could solve these problems together. Any thoughts there about, as you look across the industry, any thoughts around partnerships and how those partnerships might be leveraged to solve some of the big problems out there?
So I'm sitting in a bit of a unique partnership already, right? So I'm at this law firm.
There you go. Right?
I'm one of the only ones in the country I'm a data science partner in a law firm. And the firm was specifically set up and is predicated on the very idea that you need legal and engineering in the room at the same time solving these problems.
Yeah.
And I think, it certainly moves beyond that as well. It's making sure that you have the voices and the expertise all in the room to do the identification of the problem, and then the sort of constructing of the solution. And this is where, one of the things that I've spent a lot of time thinking about actually through my work at Georgetown has been how we take policy and turn it into data that can be applied as quantitative modeling parameters and ultimately as engineering specifications, right? There needs to be some sort of standardized mechanism to apply law as an engineering spec. And then conversely, make sure that the engineering systems are communicated effectively to those crafting policy, but also implementing legal requirements.
Yeah.
One of the things that I'm doing right now is actually working with a group to figure out what the appropriate data licensing strategies are and what the right contracting language is. It sounds, again, very pedantic and sort of deep in the weeds, but it turns out this is how we could do good data protection. This still drives to really effective products. And it's about getting tight on which data can we use, in which contexts, for whom, and how do we actually then write the kinds of language that protect those data, protect the end users, and also drive toward our sort of commercialization outcomes. So I think it's that ability to get multiple voices in the room, perspectives, and different types of applications that then really drives toward much more productive outcomes in the end.
Awesome. Thank you for that. Ngan, what do you think?
So I think it's interesting because we are literally sitting on this webinar, a partnership between a law firm. Ellie and I both have joint appointments at a university. And I think that, what we have to realize is, as much as there is tech, the underlying importance of trusted partnerships and relationships. If you think about universities in the academic setting, it is very much keyed upon like answering these questions. It's not intended to be able to scale. And then we look on the industry side, and a lot of times we don't really think about innovation. Like we get stymied by innovation because of our need to scale. I mean, in my prior role, I was at Blue Cross Blue Shield, and that's like 1 in 3 Americans. And so when you're talking about a claim system that has to cover 1 in 3 Americans, you want to make sure that every change you make is well tested. And so what that does is it solidifies and creates kind of a brittleness to the system. And so, how do we kind of think in an innovative way as well as think in a scalable way? The way we do that is we're all kind of coming at it from our different perspectives, and which is why I keep saying AI is a team sport. Being able to, I mean, that's why I'm so excited about this Health Data Innovation Lab, right? It's the idea of like we have access to all these different types of data that not all of our partners would have access to. And then we also have trusted relationships that we build that we can pull in depending on what the use case is, and be able to make sure that all the people in the room are people who have different viewpoints. And that's innovation is really about kind of the collision of all of those different stakeholders. It isn't some light bulb moment that Einstein thinks about in his garage. I mean, that's not realistic innovation. It's not scalable innovation.
And one of the things, just to kind of pull on that point a little bit, is that, I think organizations really need to find a safe place to innovate. And that's what what really excites me about the innovation lab that we have is that, some of the best innovations sometimes are done outside of the walls of the organization. And then secondly, when you can find a safe place to go and play with your data, reimagine some of the things you could do with your data. I think it makes the solution that much bigger and bolder, right? So I think that's the big recommendation. Find a great partner like Mathematica that you can work with to work with to solve some of these use cases, solve for some of the use cases. So I want to go around the horn real quick and ask the question that we asked at the top. Should we pump the brakes or should we hit the gas? Ellie, what do you think?
I don't think we have much choice. I think that the train's moving. To start mixing my metaphors here. But
Yeah.
I think this is about keeping up. I think this is about getting ahead of it wherever we can. I think this is about putting our standard practices in place. We've sort of been treating it as this new thing that is one, a monolith that we can pump the brakes or pump the gas. And I'm just not sure that that's actually quite the right framing, right? I think it's moving, and we have a lot that we can put in place to actually institutionalize and make this part of our standard governance practice. It can be part of our standard engineering practice, and we have some new tools that we can apply and some new risks to address as we apply those. But I think a lot of the practice that we already have in place in healthcare to evaluate new tools, evaluate when and where they should be implemented, make sure that they're doing that well and that they have actually good patient outcomes before we deploy them at scale. I think a lot of those processes are really where we need to focus the effort. So it's less on pumping the brakes so much as it is, let's just make sure that we're actually doing it well as we deploy.
Yep.
Yeah,
Ngan, what do you think? Yeah.
I think if you think about like the car analogy, you know, that we do concept cars first before we actually build a car that rolls out on the production line. And that I found in another metaphor for my lab. I used to use the pottery, paint your own pottery place as a place to be able to experiment and play around. But like we build a concept car, it's like one off. We try it out, we see what works, what doesn't work. To Ellie's point, figure out like what use cases are we trying to solve for, determine if that concept actually works. Because I will tell you, sometimes it doesn't work. Sometimes we're using the wrong technology. Like there are so many times when somebody says to me, well, like, can we do this with AI? And I'm like, well, why wouldn't you able to just like do that by like generating a report and a visualization and being able to identify like the outliers? Like those are not fancy. Um, but they do the job. And so, to Ellie's point, we do have tools. This is another tool in the toolbox. We need to take it out and like, run the test course with it and make sure that we have all the processes in place to determine whether the outcome is what we want and how do we implement it after we've determined that it does work.
Yeah. And I think I am probably a hit the gas person, right? However, I think I do think about this quite a bit in terms of, you know, how do you hit the gas? Ellie, I love what you said about the bread and butter use cases, right? The baseline use cases that you go after first, right? How do we take some of these basic things that we can eat? We have the data and we know we have good data. We can tackle those things and we can move on. I'm also a big advocate of failing fast, right? I mean, get out there, test it out, see what happens. I don't want us to put our patients or members' lives at jeopardy, but let's get out there and let's fail fast, right? And let's make sure we document why we failed, so we can reconfigure and keep moving. So I think I am kind of a hit the gas kind of person, but I would like for us to do it in those steps, right? Find the baseline use cases we can solve for, fail fast, make sure we document our learnings, and then move forward from there. So yeah, definitely. So I want to take on a few questions from our listeners today, and really have us kind of spend the last 10-15 minutes just really tackling or discussing some of those questions. Hold on one second here. All right, this is a really good one here. I like this question a lot, and we've been kind of talking around it a little bit, but the question is, no data will ever be perfect. How do we reconcile that with developing effective AI tools and solutions? So we've been kind of talking around this all during the afternoon. So tell me, how do you make sense of that? The data's not perfect, but we need to build an AI tool or solution that's actually going to, meet the needs of our audience, right? How would we move forward there?
So I can start. One of the areas that we're really looking at is synthetic data and the ability to use AI in order to generate data that fills in some of the gaps. But we have to come back to the fact that if you don't know that you have those gaps, then you don't know how you're going to remediate for them. I mean, within, just plain old statistics, we have methods like oversampling of certain data populations so that you start to get a set that is representative of what you want it to be. Knowing that for some use cases, we simply just don't have the data. And,
Yeah.
like maybe those aren't the use cases that we try. And so, it goes back to everything we said about understand what your use case is. And that will drive what data you need. And then, like you have to understand what's in your data. Um, and you do that by, provenance of the data, being able to measure what biases exist. And then, like we have methods, we have, and it cannot be understated too. Like we are working with like foundations and state governments and local governments to actually collect additional data. Every day I hear about, additional data that is available, and it can be overwhelming. Um, and so, there is data out there. The how you don't overwhelm yourself is you ground yourself on the use case and then look for, what data can be used to enable that.
Yeah. Do you think in some cases our customers have too much data?
Yes. Yeah. Well, because you think about healthcare, right? There is a ton of data, but a lot of it got collected in order to pay, claims. And so the things that you document when you're trying to substantiate whether or not you get paid are different things that you document when you're, like trying to keep someone healthy, or you just want to make sure that you have a chronological history of an individual. It's, so we have systems that don't necessarily reward us for things that don't get paid for to document. So that's the huge gaps that we see in the data.
I'd also,
Interesting. Go
yeah,
ahead, Ellie. Sorry.
in terms of data quality and the sort of sources of data that we're working with, I think certainly we can talk about it in the context of AI, but data quality issues have been at the heart of most of our healthcare challenges, sort of since the beginning of time, right? Understanding, diagnosing, sharing information, tracking that information through, making sure the right person has it at the right time is a major issue and always has been. What we're seeing now is the amplification of those issues, right? We're moving faster, we're pulling more data in, we're analyzing more of it, we're integrating more data sources. So I think what that really comes to is one, getting back to really good basics on the data governance and making sure that your data, the same data governance and AI governance strategies that you're sort of implementing within your engineering stack aren't just within engineering, but are within ops, are within patient care, are within every element of your organization, and that they're all following the same basic governance structures. That sort of integration and sort of institution-wide governance systems haven't necessarily been implemented. And I think they go a long way toward making sure that we're actually just doing the implementation well, and that as we start pulling in particularly sources of data from across the institutions and from external sources, that we're actually able to do that really effective data governance. So I think that's one of these pieces of, addressing good governance to support the kinds of, hit the gas scale that you're talking about, Noland. If we do that, we just need to make sure that we're really tracking what we're using and know where it's coming from. But again, to Nan's point, that's good basic data science, right? That's actually how we make sure that the data is good and the data are solid, and that therefore the outputs of the model are going to be more reliable. And then we can also evaluate the intermediate outputs and then the final outputs and of those models as well for their specific use case. So I think a lot of that is in place, and we can actually use some of these methods to evaluate the quality of the data, particularly when we're looking at statistics of small numbers. One of I think the other real value adds here on the AI side is that we can do data integration from and find data from many more sources that might start to address the small numbers issue when we're getting to unique cases or subpopulations. That particularly if we're de-identifying effectively, verifying that de-identification, then we can merge those data and start to look at patient outcomes for these smaller groups of patients. So I think there are a lot of ways that we can actually use these tools to address those issues. But again, the way that we mitigate it is to make sure that we have good organization-wide industry practices that are being implemented and governance practices.
Yeah, thank you. I was just flipping through some more questions, and this one kind of hit me because it's hit right at the heart, right? The question is, the medical field tends to show skepticism for new technology, special fields that require a lot of specialized human knowledge. How do we as technologists help to bridge that gap and build trust? That is a really good question. And I'm wondering, Ngan, you have any thoughts there about this? Because this is something that you and I kind of live and breathe all the time. How do we build trust? How do we make sure that that we have equal partners in helping to develop those solutions?
Yeah, I think the biggest piece that technologists can do in order to build trust is realize that the community, the stakeholders are a part of your journey. It is
Yeah.
not a case, I think in the past, what we've done is we've built the tech and then we've gone and we've tried to apply it to the work and said, oh, well, I think, like based on a couple interviews with a couple of docs, like I think this is how it might work. And that is the reason why we have such a distrust. Like if there's actually a study that shows the EHR, and one of the things I quoted was, check boxes are soul crushing. And that was a direct quote from a survey. And I thought, yeah, absolutely. Because, like these are people who have spent like their entire career trying to problem solve. And so like, it's not just a checkbox to them. It is a workflow. And we get back to that, data enabled workflow. In order to get to trust, you have to bring all the stakeholders together and like work with them to figure out what is the actual full workflow, who's involved in it, and then, like what pieces do we want to automate versus what pieces do we want to augment. And then you apply the tech. Like you do all of this work that is not at all technology work first. And then you say, okay, well, I think I have something that can solve this particular problem.
At the heart.
I remember one of my previous assignments, I had a quote on the wall behind me that said, respect the workflow, right? Respect the
Exactly.
workflow. And I think when you work with healthcare professionals, particularly in a provider space, I think that is a very, very critical first step, is it respect the workflow, listen to what they're saying and respect it. Ellie, any point of view you want to share?
Yeah, to me, this question is essentially, have you found product market fit? Have you actually, are you
Yeah.
evaluating whether your end users actually want and need this product? Are you solving a real problem they have? Right? I think this is, again, to Nan's point, it's not technology first. It's problem set first. What is the problem that can be solved? Where would they like help? What is their priority? And then what is the right technology to help fill those gaps? Because again, these are tools being used by people. And so we need to talk to those people. It's good UI UX testing and design. And it's making sure that then that's aligned with the technology that's going to support it. Again, and we can get a lot of that information from the end users, right? We can sit down with the people who are going to be using these different tools, whether it's patients or whether it's the providers, and ask them, how accurate do you need this to be? How much do you want to be evaluating accuracy? How much do you need to make sure it's exactly right when it comes out? And how do we communicate that uncertainty to you? There are some cases where what they need is quantitative uncertainty. Other places, they just want a qualitative sense for it. There are other times when actually they might not care too much if it's accurate if it points them in the right direction. Right? And then there are other times when there's just absolutely no room for error. And so identifying really, again, which problem we're solving, getting tight on what therefore the specification of the system is allows us to build technology that will actually meet those requirements. So I think that's how we actually build the trust, is that we're solving a real problem they have, and then they're a whole lot more likely to use it, not least of which is because it's useful. And I think we sometimes lose sight of that. We're like, well, but it's a very cool new technology. Don't you want to use it? And it's like, well, no, they're not. These are not early adopters. They're risk averse for a reason. There's a life
That's
on the
right.
line.
That's exactly right. Speaking of risk, I'm wondering, one of the questions I saw pop up was really, what role or should the government uh, play in auditing or, um, you know, enforcing data brokers to protect identity um, in this? Any thoughts about that? I mean, the government's role in this, I would be curious. Nan, what do you think?
Yeah. Well, one of the things that I advocate for, which I'm not sure if it's entirely feasible, is we don't have a national privacy law. And, that makes it difficult for people to address privacy, state by state. Any piece of software you roll out, you're basically trying to figure out like whether or not it's going to violate a law in a specific state. So I think that there's a role for a, comprehensive national privacy law. Um, but to the point, I think I'll probably turn this over to Ellie to kind of talk about like that we do have some things on the books already that are effective.
Ellie?
Yeah, and it actually, that question, Noland, dovetails really nicely with a question I'm seeing in the from that are sort of presented to the panelists from the audience as well, which is asking about liability. And this really gets us back to what Nan was just describing. So first off, when we're talking about things like a national privacy law, I think it's also really important to expand that to include a broader data governance structure, right? There's very much this necessary privacy lens, and we can expand that to be more inclusive of this broader sort of scope of what data protections are needed. And I think we can, as we start to expand that and think about how to implement that from a governance perspective or a policy perspective, where we can focus is really, how are these tools being used? What are the outcomes? And what is the appropriate regulatory framework and risk mitigation that aligns to those specific use cases? You have specific types of data, say eye tracking in a VR headset, for example, that, as we're thinking about eye tracking data can be consumer data that are focused on how the headset is used and whether you're clicking on an ad. But it can also be used, those exact same data can be used as health data or as health indicators. So we need to be thinking about regulating maybe not just the data themselves, but actually those specific use cases of those data. That's where we can then get to applying our existing regulatory framework and just making sure that we're implementing those and applying those to these AI models and to these AI products as well. So this is where I think current liability framing and current liability regulations do and should apply here. And that's going to be a matter of going back through our regulatory domains and simply applying the existing laws to this new technology. We're actually seeing that happen already. The FTC is doing a lot of that and saying, look, you can't have unfair business practices applied, whether you're using an AI model or any other system. It's still an unfair business practice. And they're simply applying that same bar or threshold to these new types of products. So I think it's a yes, and we're going to need some new regulation that really does lay out requirements and standardizes those. To your point, Nan, it's really hard to do business in an environment where every state has their own details or differences. And we also then just need broad application of the laws that are already in place.
Yeah, I mean, I think we
Thank
have like privacy laws and trademark laws and all of these, that is currently being adjudicated. And what we can't have is this weird exception that we've had in the past of, well, I'm a technology company and I need to be able to innovate and grow. So therefore, all of the regular common sense regulations don't apply to me. And like that has been what has happened with technology so far. And so we have to be careful as practitioners in this space that we are accepting that there is a level of responsibility that technology has to, work by the same rules of the road that, somebody who manufactures a Caterpillar, makes, or, a semi truck.
Right. This has been an incredible discussion. I really enjoyed it. And Ellie, I always enjoy talking to you and Ngan and just getting your ideas. I hope that we can do this again. I want to close this out and really thank our participants for coming on, thank our panelists for coming on, but thank all the listeners that we've had join us. The one thing I would like to leave with is that Mathematica, we are data experts. That's what we do. And data is foundational to building any AI use case. And I think, start with us first before starting with the use case. I think we can help you understand your data, contextualize your data, and really help you understand if this is something you should be doing in your organization. So I want to just, Ellie, thank you very much for joining us. I really appreciate it. Ngan, thank you very much. And I would like to close out here and wish everyone a happy afternoon. Thank you.
Thank you all.